Hi there, I'm Sandy Castillo, and I'm a 3-year breast cancer survivor. I'm also a member of the Alamo Breast Cancer Foundation and handle government relations for Houston. And I also am a state leader for the Young Survival Coalition, which supports women under 40 diagnosed. I'm also a committee member for the Breast Health Collaborative of Texas, a volunteer for CanCare, and also for the National Breast Cancer Coalition. I'm excited to be here today with Dr. Carol Lange at the San Antonio Breast Cancer Symposium. And thank you, Dr. Lange, for coming in today.
Thank you, Sandy. I'm Carol Lange. I am a professor of medicine and pharmacology at the University of Minnesota Masonic Cancer Center in Minneapolis. And my work encompasses the role of steroid hormone receptors in breast cancer.
Excellent, excellent. Well, we really enjoyed today. We enjoyed getting to see you today at our Hot Topic mentor session. And so my first question for you is, what would be the most important takeaway after listening to everybody today that would support young women who are newly diagnosed and would be under 35?
Well, young women typically, when they're diagnosed, they frequently have a more difficult to treat breast cancer that's more dangerous. Frequently, this is triple-negative breast cancer, and this is more of a daunting type of disease. But I think the message from after today's talks was that before today, we really didn't have very many ideas about what contributes to this breast cancer or how to treat it. And I saw 2 talks today that particularly addressed this question by trying to understand the biology of those particular tumors in young women. And they identified new pathways that can be targeted by drugs. And they also identified that these commonly upregulated pathways cooperate frequently and are co-expressed in breast cancer, and that we already have drugs on the shelves that can target these pathways. And so I think that we're entering a period of time where we can have the rapid identification of new targets for therapy, and so there's going to be new things happening very rapidly now. And that gave me a lot of encouragement and excitement for what's going on in the field.
Right. Now, what would this, how would this translate on Monday for anybody who's newly diagnosed with triple-negative breast cancer?
Well, I think the thing at this meeting that's unique especially is that the clinician scientists who attend this meeting, they all see patients, and they're among the most educated doctors out there as far as what's the cutting-edge treatment. And they're unafraid to have their patients enter these new clinical trials, and they're patient advocates as well as doctors and scientists. And so I think that if you have a diagnosis of breast cancer and you're a young person, you want to go to someone who is on the cutting edge of the treatment. And those treatments are more and more diverse. They're more and more confusing. But I think if you consult with a doctor who's on those treatments and goes to this meeting or meetings like it and knows what they all are and has that in their bag of tricks, I think that's key. Is now that there's this huge variety of treatments, it's a matter of selecting the right patient for the right treatment, and there's a number of diagnostic tests that can help do that. And I think now we're entering an age of much more personalized medicine, where we say, okay, which patients will benefit from this treatment and which wouldn't. And I think we're much more able to identify those patients now, and that'll just keep continuing.
And speaking of all those tests, I know that there's so much technology is so advanced, and there's so many new tests coming out that I almost feel like drug trials are kind of lagging in being able to take all of that specific information that we receive on each person and their cancer and helping them define their personal therapy.
I think that's probably true. Yeah, I think that it's really hard to accrue patients. It's really hard to know of all the diverse combinations of treatments, what are the ones that are most likely to succeed, and how do we take a limited number of patients and make sure that we're going to treat them as best as we can without sort of sacrificing patients to the process. You know, how are we going to identify the most likely to succeed treatments? And I think that that's going to be the combination of many different researchers that come to this meeting and confer notes and compare notes and say, wow, okay, all of our data combined suggests that this is the best way to go. And I think that's the cutting edge, is to really look at the combined data from hundreds of laboratories, not just a few, that kind of point to one direction or another, and hopefully be on the pulse of that and be on top of that.
I think that's the miscommunication with just everybody out there, is that there's one cancer, and each cancer is so specific to each person. And so when you get these different tests, and it's different for each person, each therapy is completely different for, again, each person in their cancer. And so can you talk more about that and how specific each cancer is for people, and again, different tests work for each person?
Yeah, so it is true that every cancer is different. Even every breast cancer is a different disease, unique to that person, and all of the risk factors that they may have. And so there's a number of tests that are being developed, and I think we'll see more and more of these. One of the underlying things from this meeting that there were a lot of talks and presentations that compared the various tests to each other, one to another. And I think one of the underlying themes was that there are some new tests that just rely on a 2-gene signature, a ratio of one gene to another. So instead of dozens of genes or 23 genes or 22 genes, there are some tests outperforming others, and most of them are quite similar right now for early disease, where Ki-67 is still really important as a proliferative marker. Tests that include that, most tests do include that. However, there are new tests that use a more limited number of genes and can perform just as well or better. And I think so right now we're in the age of rapid discovery of these different signatures, gene signatures, and everyone's sort of patenting them left, right, and center and trying to market them. And that will sort out in time with the clinical data to say which test should you have if you have this disease or that one. But I think that the value of those tests is they help guide treatment, and then they can spare women from harmful treatment. Like if you don't really need chemo and you take one of these tests, it can show you that maybe the chemo wouldn't help you, or you should have chemo because you have more aggressive disease. So I think they're very helpful clinically. You're going to see tons of them, and they're going to be very confusing. But I think that in time it'll sort out sort of what are the best ones. But right now we're going to, I think you'll see a rapid expansion of all these diagnostic tools. It's the way to go. Paired diagnostic. It's absolutely the way to go. However, how do you sort out which one is which? I think that will come, but it will take a lot of patience enrolling in clinical trials before we know.
That's why I feel that this symposium is so important, because you bring people together to talk and collaborate, because everybody seems to be doing something by themselves, but together we can actually try to move closer to a cure or some kind of cures for all the different cancers that are out there for people. And I think that's another point to continue driving home, is that everything is so different and specific for each person that you have to be so concerned about different factors. And so maybe we can talk about that, because you talk about genetic factors, and cancer is a disease of genetics, but what about environmental factors or other factors that go on in terms of age and race and ethnicity and so on and so forth? Can you talk more about that?
Sure. There are risk factors that are out of our control. The biggest risk factor is being a woman to get breast cancer. The second biggest risk factor is age. Can't really control these things. Hormonal exposure is another risk factor, but there are a number of risk factors that we can control, and these are diet and lifestyle. So it's known that a healthy diet, which is a low-fat diet, and a moderate level of exercise can greatly reduce breast cancer risk. It's known that taking vitamin D can reduce risk. So there are things within your control that you can modify, lower alcohol, taking vitamins, eating the right diet, or exercising 3 hours a week or so, would all be things that are in your power. And when you can't control your genetics and your age and your sex, so at least you can do something. And I think that, for example, with exercise alone, I'm not in this field, but I do know that just a moderate level of exercise can greatly reduce breast cancer risk. So, for example, hormone replacement therapy can increase risk a little bit, only about 1.5%. But exercising 3 hours a week can reduce risk by 20 to 30%.
Wow.
So that's a huge amount for a very low investment of your time.
But then you
plus
still
all the other benefits.
Right. But then you still have your genetics, your genes that you're born with. And like I always say, cancer doesn't care.
Right.
You can exercise, you can meditate, you can do all of these things, and then you still get cancer. So it's really how you take care of yourself once you're diagnosed too, and the right people that you get around you. Obviously, getting the right people, the right tests, the right group of people, because it becomes your own collaborative effort. Besides being here on a bigger collaborative effort to help support cancer and our standard of care, it comes down to your own little micro community and how you take care of yourself.
I'm always telling people knowledge is power. Learn as much as you can about your disease. and then surround yourself by people who love you and care about you and can support you, and smart doctors, and that's the way you get through it.
And becoming your own patient advocate.
Absolutely.
Because you really need to do that. It really makes a difference on how you can actually help affect everybody else around you, too.
Definitely. I couldn't agree more.
Well, thank you so much, Dr. Lange. I really enjoyed having you today.
Thank you for having me. It's been terrific.
All right.